Good morning and welcome everyone to the 2021 Women and Girls Alliance Summit, Recovery and Discovery, Women and Girls in a Dual Pandemic. I will hope you will enjoy the sessions. Our session is COVID-19 and the Spanish-Speaking Diaspora. Now we're going to explore how the pandemic has impacted the Spanish-Speaking Diaspora. My name is Susana Cisneros. I'm a senior lecturer at the Language and Culture Studies Department here at UNC Charlotte. I'd like to introduce our panelist today is Dr. Kerry Reeves. She is the Director of Research and Evaluation of the Camino Community Center here in Charlotte, North Carolina. Camino Community Center is a nonprofit organization focused on equipping all people to live healthy, hopeful, and productive lives. Since 2003, Camino has served low-income families in the greater area of Charlotte through a health clinic, a mental health clinic, a thrift shop, a food pantry, homeless outreach programs, and a variety of other health and human services. The community center is bilingual and multicultural, bridging gaps between language and cultural barriers for families in need. While the community center serves all families in need, the majority of the clients are uninsured Spanish-speaking immigrants. Our second panelist is Ms. Marlene Sallo. She is the Executive Director of the Disability Law Center in Boston, Massachusetts. The center provides referrals, technical assistance, and representation regarding legal rights and services for people with disabilities. Ms. Sallo has also previously worked at Unidos US, the nation's largest Hispanic civil rights and advocacy organization, where she has developed issued awareness campaigns to educate Unidos US affiliates, states and federal government officials, and the public on national and state level policies and initiatives that disparately or disproportionately impacted the Latino youth. So welcome. This is something that is very interesting to have to learn about how COVID-19 and the Spanish-speaking diaspora has been impacted. We are going to be allowing our panelists to tell us what are the stories or reality checks that you both have endured in these few months, to say the least. It's over a year now, but okay, Marlene, would you please give us your insight?
Sure, thank you very much. And it's a pleasure to be here with everybody today. So through the Disability Law Center in Massachusetts, as well as through my work with the American Bar Association, serving on the task force, the COVID task force, we've seen many issues arise as a result of COVID, not only at the beginning of the pandemic, but even now with distribution of vaccines. And what we've seen across the board from a healthcare perspective, whether it's medical care or public health, is the Latino community has been hit hard by the pandemic. In Massachusetts and across the nation, we're seeing individuals who are from the Latinx community who are also frontline workers. And as frontline workers, they have to be at work, right? They don't have access to healthcare like others might, so they can't take time off. In some instances, the Federal Medical Leave Act that was put in place to actually provide paid leave for individuals that are affected by COVID directly or indirectly may not necessarily apply. In many households, we have students that have to stay home, right, because of the pandemic, and that they have to access their schoolwork using the internet. But what if the household has more than one child? And what if the household has only one laptop? And everybody has to use it. So, or what if the internet access is not dependable? Especially if you live in the rural areas. So we see a lot of that. not only in the delivery of services, but also in just access to resources where resources are lacking. I also serve on the Massachusetts Commission on the Status of Women as a commissioner, and we actually held a hearing, a COVID-related hearing last year at the beginning to learn more about what was happening in our communities. And what we heard in general from women and girls is the lack of services, lack of access to food. You know, how do you deal with homeless? If you're homeless, how do you protect yourself from COVID? And how can you get connected to the services that you need? And the additional layer to that is if you have a disability and you need oxygen, or maybe you need to hook up whatever durable medical equipment you have at night, right, to get charged to the battery. Sometimes the homeless shelters don't allow you to stay there because of that. We had one case of a woman who was an amputee, and she needed to charge one of the limbs that she had, and it was taken away from her because she couldn't have a battery pack there. So you have all of these intervening issues that pretty much kind of meld together to make things worse than what they are. But then when you have a language barrier, or you're considered an immigrant, or you're working 2 to 3 jobs, it just seems to all magnify to a level that can be unmanageable at times. And then the additional layer to all of this is the language barrier, which is present in many communities. Some communities are better at translating resources, like information for resources, than other communities, and others are not. And then when we try, at least through my agency, to get translators or interpreters, sometimes they're just not available because they're needed across the board by so many different entities. So that's a really general overview of what we're seeing, but the numbers continue to show that the Latino community has been negatively hit by COVID, and we need to do better and be better at reaching the communities that need the services and providing those services across the board and not just for specific pockets. I don't know if I answered the question.
I just have to follow up with this. So you mentioned that you do get some material translated. Sometimes interpreters are not available. What is the degree of literacy of the people that get the material in the language and actually can follow through the instructions?
So the original document at times is not in plain English, or the original document is really, at a college level. And so we have to put it in plain English, and we try to stay between, depending on the communities that we serve, because our communities are dual, right? They have some have disabilities as well as a language barrier. So we've done 4th and 6th grade readability level. I don't know, if we're hitting the mark. I have to be honest, like it's, even when we try to reach out to the Latino community, we were using Zoom platforms. And then after speaking to members of the Hispanic community, we found out that they prefer Facebook Live. And that's really where they go when there are live platforms. And so we shifted to that. So I think being culturally, having cultural humility is important in this line of work, because we don't know what we don't know, and we have to ask the questions, and no 2 communities are alike.
Right. Well, thank you, Marlene.
You're welcome.
Thank you very much. Keri, can you tell us a little more about your job at Camino Community Center, and what have you seen the impact of COVID?
Absolutely. Thank you guys so much for the opportunity to be here today. So I'm with Camino Community Center, which is in Charlotte. So for those of you that are in Charlotte, you may have heard of us, or in fact, I hope that you have heard of us. So we are a nonprofit that primarily serves the Spanish-speaking Latino immigrant community. Most of our patients, 98% of our patients, are first-generation immigrants who speak Spanish. And Camino has been here for more than 20 years to begin establishing the trust with the Latino community and to serve the families here. Some of our main services are a primary care clinic. That's probably what we're most well known for, and that's one of our services that's been around the longest. And so we do have a low-cost clinic. We also have behavioral health services where we do mental health counseling. We're working on some other things with peer support, and things are coming down the pipeline with that. We have a food pantry to help address food insecurity. And we have a social navigation program that really aims to connect the community members to all the services they need, whether that would be internally at Camino or externally through our community partners. So our vision here is to have holistic services that meet the physical, mental, emotional, and social needs, as well as spiritual needs. There's also a church at Camino. It is separate from the community center, but we do have this holistic approach to care. And so we try to assess the needs around the social determinants of health and then refer patients to different services based on that. So specifically with COVID, as Marlene mentioned, and as Susana, as you mentioned, the Latino community we know has been disproportionately impacted. And I think this pandemic has just heightened the awareness of all of the disparities that exist for this community. You've mentioned language, and that's a huge one, but I'm going to talk a little bit about some other things that I've seen here. So when the pandemic first started last March, which it's hard for me to believe it's been a year. It has been, a full year of this. But the first thing that we saw was this immediate panic and need for food, because as Marlene mentioned, a lot of our Latino community members are frontline workers. But at the beginning of the pandemic, a lot of things were being shut down, especially restaurants. We have a lot of construction workers, and those projects were being paused. So we had people out of work and people who had never needed to access our pantry before that were calling, showing up at Camino, because again, this is a trusted place. So there was this skyrocketed need for our pantry services. So that was the biggest thing that we saw first. And so we really pulled together and started raising money, writing grants, to be able to offer more food. We expanded our pantry from 2 days a week to 6 days a week during the height of the pandemic. Now we're back down to 4 because some of that has been a bit has gone down a little bit with some people back at work. But that was the biggest thing that we saw. And then we started to notice that people were having to miss their appointments at the clinic because they didn't have money to pay. So we do have a program where we have a charitable program where it's a very, very low cost, or if the patient can't afford it, we work with them. But we also have a membership program where you can pay a very small copay to the clinic to sort of help with some of the sustainability. But we had a lot of patients who were canceling their appointments because, again, they didn't have the money to pay. So those are some of the main things that we saw. And then what I really want to speak about, though, is about mental health and behavioral health. And this is something that I've really seen come out very strongly as a result of this pandemic. So we started a program. We had started planning a program pre-COVID called Camino Vida. And this program is a lifestyle intervention, nutrition and physical activity based, to help patients manage their chronic disease. So we have a high proportion of patients here who have type 2 diabetes, who have hypertension, which is high blood pressure, high cholesterol, and some patients who are managing being overweight and hoping to lose weight and things like that to become healthier. So we implemented this program, Camino Vida, and this was pre-pandemic, but we still were able, despite the pandemic, we've been able to push through with the program, which has been amazing. But keeping in mind that the idea behind the program, even though we hope to serve holistically, really the idea behind it was about physical health, right? We were looking at clinical outcomes to hopefully improve people's numbers. We are looking at stress, and we were hoping, maybe this program will help people be able to manage their stress through exercise or through eating healthier. But what has been amazing is to see how much the program is impacting people's mental health and the stories that are coming out of this. So the way that the program works is that a patient is referred from the clinic directly to this program, and they meet with a health educator or an exercise physiologist. And again, the idea is that these people are helping them plan about making, small changes to their diet or exercise and giving them resources. We give them resistance bands and all kinds of things. But what's happening is patients are opening up and talking to them about their stress and about how they're feeling and how overwhelmed they are. And all of these things are coming out from this, from these meetings or these sessions that we really hadn't expected. And it's been amazing to see the trust that's being built. And I think these patients are building rapport with these health educators and exercise physiologists so that they feel safe and comfortable to open up. And I think that, there's a big stigma around mental health just in general, I think, for everybody, but especially in the Latino community. And so what's been interesting is that we are actually measuring stress, symptoms of stress, depression, and anxiety through an instrument called the DOS. And when we measure it, we see very low levels of stress in almost everyone. But then what we're hearing from them is a totally different story. And what they're opening up and sharing anecdotally is completely different. So it's bringing up a lot of interesting questions for us that, what's really happening here? Is it possible? And let me back up for a second to say that 73% or 73 to 75% of these participants are female. So is it possible that they aren't even recognizing that this is stress, that they are stressed? They're not acknowledging it as stress on a paper, on a scale, saying, how stressed are you? They're not really. But what we're hearing is stress, or what we're hearing could be anxiety, and it could be a lot of different things. And then we're mentioning the idea of them about the behavioral health program. Maybe you might want to speak with a counselor. But we're not always seeing a follow through there. So it's possible that it's not really being registered as like, yeah, this is something I need to talk to somebody about, but they're informally willing to talk about it, if that makes sense, but maybe not formally sign up for counseling. And something else that we noticed too with some of the female participants is that when this idea about counseling was brought up, they were talking about their husband and their child. Everything they talked about centered around their husband and their child. And then that their husband was very stressed. So when this idea of going to counseling came up, the woman said, well, yeah, I'll mention that to my husband. So to her connection right away was, well, maybe my husband could benefit from counseling. But I don't think she even realized that his stress was causing her stress, and his had to do with his job and everything right now that's happening with the pandemic. So I think that's been one of the most eye-opening things here. It's just it's unveiling all of these mental health issues that might be lying underneath that we're not recognizing and we're not seeing. So I'm going to stop right there for a second to see if there's, I think I might have answered your question. But it's been very eye-opening to say, are Latino women even realizing that they're stressed? And if they're not realizing that, then they're not likely to take those steps to manage and cope with it. And there's also sort of this idea of the female being the caretaker of the family and just thinking that this is just part of my role. I'm a mom, I'm a wife, this is what I do, and not really realizing, hey, this might be stress. There might be something, I might need to really do something. And it could be a lot more than stress, right? It could be anxiety, it could be depression, and a number of other things.
And you both described very well on the surface how this pandemic is impacting. I just want to follow up with Marlene and ask her, when schools shut down, and we're talking about schools with children with disability, what was the most impactful thing that people were asking for, people were needing, and people didn't realize? Maybe like Keri explained, like things came out, but in the back door, not in the front end when you guys were asking.
I felt as if the community of parents that have students with disabilities were the forgotten group. I mean, that's just my honest opinion. They started, a perfect example, they started giving out MacBooks to students, and the students that have disabilities that required something other than a laptop, right, to access the educational system were a second thought. The information that was being given out initially by many of the school districts were in English only, and totally dismissed the other the other ELL communities across Massachusetts. Access to mental health services for youth that are part of their IEP were not being made available from the very beginning. For those that could access services, Massachusetts became like the head of the telehealth world, right? Like, oh, you can get all your medical appointments through telehealth, but then where is the Spanish-speaking person that can facilitate the meetings? And so that was also another issue. But the main issue for certain parts of Massachusetts was lack of access to the internet. That was the main issue. Or the fact that there were multiple relatives living in the household, including children, and they all had to use the same internet service, which may not have been the strongest, or they have to share 1 or 2 laptops for the whole household because the schools still haven't gotten to them. And so maybe a few months into it is when they started realizing, after many conversations with the folks at the head, that, hey, we need to really target the Latino community to address their specific needs. And how are we going to go about doing that? Let's start with the translation. Let's start explaining to the parents what their rights are, even if they're working from home, as it applies to the IEP. So it was that lack of education and outreach that targeted the Latino community from the beginning that I also felt left a lot to be desired for families that have kids with special needs that are also Hispanic.
Thank you. I was very curious about how it was handled. I would like to take you, both of you, to a deeper problem within the culture. When we talk about stigma, about females' behavior, when we talk about females' unknown rights, because before, when kids were in school, teachers were able to, sort of speak, advocate for them if they seen something that they should report. But kids are not in school anymore. And what happened with those opportunities to be observed and have follow up, and what's the mental health? What is the impact with our girls that now they're not in school? Keri?
I don't know that I can really speak to this particular issue, because we're not doing a lot of work with school age children. Most of our work right now is focused on adults. But I do think that this is definitely an issue with kids staying at home, and there could be issues in the home that no one knows about. But this particular issue, I'm really not very well suited to speak to this. So I don't know if Marlene wants to jump in and address this one.
I can try. So what we're hearing, both on the ground at the state level, but at the national level, is concern for abuse and neglect, and that going unreported because you don't have eyes on the child from the teacher or the counselor's perspective, or even the coach's perspective. And so there seems to be 2 ways of viewing it. Some people say, oh, the numbers are down, so that means abuse isn't happening. And then other people are saying, well, the numbers are suppressed because no one's reporting it, because no one's seeing it. But in conducting outreach with women and girls, what we hear is there's depression from being at home because you're not connected to your classmates. Some young ladies have reported anonymously that they're concerned for their safety at home. And so how do you reach them if it's an anonymous reporting through an online survey that you're trying to conduct? There's also the additional concern that the parent is a frontline worker. And so the young woman is now left in charge of the younger siblings. which takes away from her ability to actually access schoolwork, which then can lead to depression. But access to mental health services is very poor at this point in time in certain communities. So there's that total disconnect, which can really start this process of just everything just falling apart for the young women at home. And so I think that a lot is going to come to light after we get to the other side of this pandemic. I mean, it's already many discrepancies and many poor service delivery models have already been laid bare, but I think it's going to lead to some serious introspection, not only from the school system, but also from the mental health system of what could we have done better to actually provide services to everyone and not that was accessible and that accommodated the needs of everyone that we were working with. Because that's the other thing, is that we're not seeing, like, for instance, our agency, we get calls all the time from parents, whether they're trying to access school services or DCF services for their child who's in foster care, or even medical services, saying that, you know, I'm being denied access, or they're not accommodating the needs of my child or my personal needs, because I myself have a disability. And so we get involved and make the phone calls to the service providers to try to not only remind them of the need to be accessible, you know, to make it accessible to everybody, but to also comply with the ADA as a public service agency. They have to comply with the ADA and they have to accommodate everyone's needs. And if that means, you know, using ASL interpreter while you're trying to deliver mental health services, then you have to do that.
Mm-hmm. So going back to the public that goes to Camino, let's move back to Charlotte. The population that you mentioned, Keri, is mostly Latinas, females. And in that population, can you give us a little more of a description of that population in terms of ages and in terms of countries of origin? Because what I'm curious about is if there any difference between the ages of the females that need the mental health, especially the group that probably recognize the stress on someone else, but they don't recognize it on themselves.
Absolutely. So most of our patients at the clinic are middle-aged, in the range of like 40s to 60, basically. So that's for Camino Vida and for the clinic. So I think a lot of those women are parents. Some of them are maybe grandparents. And so they're definitely feeling these responsibilities of being the mom, being the caretaker, being the head, you know, of making sure everybody's taken care of. And so in terms of country of origin, we still see right now that about half of our patients in the clinic are from Mexico. But we keep seeing an increase in some of the immigrants that are coming from Central America and coming from some of the other countries. So I think that's starting to change a little bit, especially here. I'm not sure, you know, how it might be different in somewhere like Boston, but I think we're starting to see this trend of immigrants coming from Central America through Mexico and then up through, you know, Florida or wherever else, and coming up to North Carolina. So we have a good number of immigrants from Honduras, from Guatemala. We're seeing more people coming from South American countries as well. So that's kind of gives you a little bit more about the country of origin. We do have almost 20 different countries represented here. So we have a very diverse mix of people. But I think, to go back to your question about the women and the age and sort of, you know, why they may or may not be recognizing their stress, and I kind of touched on this or hinted at this before, is this idea of being the caretaker, where, you know, a lot of times with women, I think we put all women, I'm going to start by saying broadly, many women put our own needs aside, right? And fail to take care of ourselves because we're taking care of other people in our families. I think this is especially true for women who are mothers, but even women who are not mothers, I think just often kind of take on these caretaker roles. And in Latino culture, we see this happening. And I see this in the research quite often, this sort of idea about this cultural ideology of the woman taking care of the husband, taking care of the kids. So I think that might be part of this pattern that we're seeing. We're actually in the process of planning some focus groups to talk with the participants from Camino Vita to learn more about what's happening right now, about their stress and about, how they're conceptualizing stress, how they manage it, basically just so we can learn more. We want to hear directly from them. And I think Marlene said earlier, we don't know what we don't know. We need to speak directly to the community members. And so we're going to talk with them and just get a better idea of what they're actually feeling, and whether, I might just be speculating some of these things, or I'm reading it in the research, or I'm talking to other people who are Latino, but we want to hear directly from them. And so we can then use that data to start informing and developing some other services maybe that are specifically for them. And then also for youth as well, because I know you asked that question, and I don't have a lot of experience with that right now, but I'm sure if I spoke with some of our behavioral health counselors, that they would have a lot more experience and could be able to speak to that. But I think being able to offer some behavioral health services for youth and adolescents is very important. So really talking and letting the data guide what we do. I'm a researcher, so you're going to hear me talk about data naturally, but we do community-based research here where it all comes directly from the community members. So another thing that we did since COVID has really been, like we said, around here for a year now. And we're seeing a lot of data nationwide about how Latinos have been disproportionately impacted by COVID. But when I started to look for data about the impact of Latinos right here in Charlotte, I really couldn't find much of anything. So we at Camino decided to do a survey to better understand the impact of COVID on their mental well-being, their physical well-being, their finances, and all of these things. And we had overwhelming responses telling us how things have negatively impacted them. So we had 89% of respondents tell us that COVID has directly impacted their mood. 89% said that it has made them more stressed. In terms of finances, 77% of the respondents said that their household income had decreased, and 64% said that somebody in their household lost their job. So that is coming from people right here in the Charlotte area. Not all of them were Charlotte. Some were Concord or Huntersville. We even had a few out throughout North Carolina. But this was coming from our different networks, our patients, our church members, sending it out to everybody. We had 370 people fill out this survey in less than 24 hours because we did this big push for, hey, we want to understand what's going on. We want to collect data. Camino has that trust. We were able to network and get it out there. We ended up with 422 people responding to that within basically 3 days. So it's enough data that I feel good about saying, okay, now we have a better hold on what this looks like in this community. Now we need to start moving on and doing something about it. We need to start making sure that these people have the access to these services to help bridge all of these gaps that we're seeing straight in the data and that we're hearing from our patients.
Thank you, Keri. So there is a question in the chat that is related to the Marianismo. If you're both familiar with the Marianismo, it's a concept which is womanhood is romanticized, idolized as a passive subject that sacrifice everything for their husband and their children. And the question is, what are your thoughts of the concept of Marianismo and how might it be related to lived experiences of the Hispanic women in the age of COVID?
So I'm not familiar with the actual term Marianismo, but I do know what it means because I've seen it manifest itself, not only in my household with my abuela, but even myself. And when you speak to the women throughout the Latino communities, because the Latino communities in Massachusetts are really pockets on both the East Coast and the West Coast, they're carrying the load for the household. They're, sometimes they're working 2 jobs, and then they're also there to help their husbands who may also be working 2 jobs. But it seems like they take everything because it's viewed as, this is my job. This is what I'm supposed to do as a parent. And they don't stop because they can't stop, right? Because they're the ones that are keeping it going. And I say this from experience. My kids are like, I got to keep it going. I'm running an agency. I'm doing X, Y, and Z outside of the agency. And I'm also helping my kids who are in another state because they're also in need, right, of support during COVID. They're also feeling the effects of what's going on. And we tend to put everybody else's needs before ours first, because we view that it's just the way it is. But when you add a pandemic to that and the stress associated with that you all of a sudden you're feeling ill, and it may or may not be COVID, but you don't have the time to stop and get tested because you're needed. You're needed. And for some families, if the mom stops working, then there is no income. And so that is just a snowball effect to the point where that person can end up in the hospital, whether it's COVID related or just stress. But I never heard that term, but it's perfect. And it truly aligns with what I saw with my own abuela, who just took it all in. And it didn't matter what anyone that approached her, what issue they had and what she was going through personally. It was her job as the matriarch to get it all done. And I'll just come last.
Mm-hmm. Yes, I completely agree. That's exactly what we're seeing here. And I think that term I'm familiar with the term from academic research, from the academic literature. I've seen that term. I've never actually heard it used otherwise. Whereas like machismo, I hear that term used even here at Camino, but, and I'm not even sure if I pronounce it right, but Marianismo, I've seen in the academic literature. But I think everything that Marlene said was spot on. And I also want to add to that and give you a very clear example of how we see this playing out. Think about any time a woman needs to go for any type of appointment, a doctor's appointment or anything. And where are her children going to be during that time? It seems that it's just almost always the woman's responsibility, that either she's got to figure out a babysitter or childcare or something, or the kids are coming with her. And that's what we see here most often. And I know a lot of times I see this in Latino culture is we bringing the kids with you. So the woman is always bringing her kids for her doctor's appointment or for these Camino Vita appointments. So, I think there's always this expectation of, like you said, Marlene, I've got to take care of it. The female has to take care of this and figure it out. I mean, I know I've used this example before, but I don't see my husband trying to lug our kid everywhere that he has to go, because he knows that I will do it instead. And I realize I'm not Latina, I'm white. So some of these things I think go across all women. And then I know, though, I'm seeing a difference here in this culture of that responsibility, though, of that matriarch of the family. And so, like you said, if you're sick, you're not going to go get tested. But not only that, you may be feeling sick because of all the stress. So it might be the mental health, and it might be those symptoms, and you're really feeling unwell. But again, you're just like, this is just the way things are. This is just how it is. And not realizing that there are things that we could do maybe to help ease those burdens. And so I definitely see this play out every day here, but it's been compounded by this pandemic, and especially with the kids not being in school and doing remote learning. And so then there's even more layers around childcare and how do I make sure my kid is learning at home, especially if I don't speak English, right? Thinking about these parents who are trying to help their kids learning and they don't even speak the language. So there are just all these layers that this population has been far more impacted than non-Latinos or people who are speaking English and can communicate and don't have to worry about things being translated. I will say one of the things that makes me very proud to be at Camino is when you come here, things are typically in Spanish first and in English second. And you walk in the door and people who speak Spanish are greeting you. But there aren't a lot of places like that, especially here. Charlotte is has sort of a newer and emerging Latino population. So there's a long way for us to catch up for the need for bilingual services and the actual availability of those services.
Yes, I agree with you. I live in South Charlotte, so I have seen it. I would like to move now to multi-layer obstacles that you have encountered. Is there any very specific frustration about how to accomplish the task of getting to the Latino community? And what are your hopes? But before you think about that, there's a question on the chat that says, which forms of communication about resources and services for the community have been most successful during the pandemic?
If I may.
Yes.
So because Spanish is my first language, I was able to coordinate with a Spanish-speaking radio station and to provide some public service announcements, either live or by providing information to the radio host to then disseminate to the community at large. So when we needed to push information out, that was one mode that we used. We tried using Facebook, and that was hit or miss at times. Also trying to connect with service providers in the community that can also push information out, because our agency is, provides specific types of services, but I think it's knowing who your partners are and working together to elevate the information and then to amplify it. It is very important, because we can't all live alone on an island, right? We all have to work together. And I think that COVID really brought that to the forefront, is that if we join forces, then we can really push the information out and try to get the services out as best as possible. Unfortunately, in Massachusetts, has the Latino community, but it's not at the forefront when it comes to like TV or radio. So you have to really connect with the folks that are doing it in Spanish to get the word out. The other thing is the healthcare providers. Some of the neighborhood clinics, they really also started gathering information and pushing it out, because I know that it's not part of the question you asked, but there's a lot of misinformation and disinformation out there. And so using trusted figures to get the info out is also very important.
And let me just follow out there, because, sorry, Keri.
You're fine.
So if the pandemic didn't happen, this will be delayed for another decade, 2, 3, 4, 50 years from now to actually amplify and make the information accessible.
I mean, I don't want to believe that it would take that long, because some of us are really trying, but in certain communities it will. I think we always need to take the people first approach, and that approach needs to accommodate the needs of everybody. And we all just need to get into that train of thought, that it's not just about you, it's about everybody.
Keri.
I was just going to agree with Marlene, especially about the trust. In terms of communicating information, I think the trust is huge. We have seen that firsthand here. Camino has that trust, and talking to our patients. So we did a vaccine clinic on February 13th, where we partnered with the county health department, and we were able to provide 80 vaccines to Hispanic residents who are 65 and older. And in talking with some of those patients, they were basically saying that they weren't really sure even what COVID was or what the vaccine was, but their provider from Camino Clinic called them and talked to them about it and let them know, what the vaccine would do, how it works, that it would be safe for them to take. And they felt comfortable to come and get it, because it was like, my doctor, somebody I trust, has told me it's okay, basically. And we know that the power of trust is huge here. And so I think that the county health department partnering with Camino to reach the Latino community was very, very wise. They definitely went about that in the right way. So I think we need to do more partnerships with the community organizations and the people that actually have the trust. Because as I said, our frontline staff here at Camino, most of them are Latino, most are immigrants, and they are Spanish. They walk up to the clinic, they see someone that they can communicate with, that they can relate to. And so even giving out information about the vaccine or about the pandemic or about resources, when it comes from Camino, people are more likely to follow through. We've seen that firsthand. We've also asked our patients how they want to receive information or how they receive information. A lot of them are saying through TV. I think through some of the Spanish news channels, and then through Facebook is usually the second way. But again, I think on Facebook or wherever, it has to come from a trusted source. There are too many things out there. And if it's not your first language, you just really, how would you even know where to start and what to believe? I think we have to make sure that we are giving accurate information in a way that they can understand, in a way that they can feel comfortable believing and then coming to access the services that they need. I think I just want to say this part again about this survey that we did. I think this is a perfect example to let you guys know how much the community trusts Camino. We were able to get 370 surveys filled out in less than 24 hours. And not only that, but 90% of the people who filled it out were immigrants. And we even asked them if they would feel comfortable sharing with us what their immigration status was. And 20% of them told us that they were not documented. And the survey was completely anonymous. But still, the fact that they felt comfortable enough to say that, it just shows how much they feel that they can trust Camino. And because of that, they will come in here for services and they will come to get the vaccine. And that does give me a lot of hope. And I would also love to share the results of that survey with you guys. We're just having it published. So I would like to be able to email that out to you guys at a later date, after probably next week.
Thank you. Now I would like to go into what are the role models that we have in the Latino female that is giving either encourage or discourage to our girls. Because we talked about Marianismo, we talk about a lack of access, we talk about the stress of the parents, but how all these items are the role models to our girls that will be the future, that they are the future. How do you see these role models impacting their lives in the long run?
So are you inquiring about how women are approaching COVID and how that can ultimately set a path for the young ladies that are observing it?
Yeah, exactly.
So I think it's mixed, to be honest. If a parent is forward facing about the fact that I'm stressed and this is a lot on my back, and I need help, then we're teaching our young women that it's okay to ask for help and that you don't have to do it all. But at the same time, for those of us that grew up in the Marianismo household, when we see that, we continue to perpetuate it. And sometimes at the demise of our own health, whether it's mental health or physical health. And so trying to find a happy balance there is extremely important. And it takes some forward thinking and some very focused approach to this, in the sense that we're going through a lot and it can be overwhelming at times. But if we work together, we can get to the other side, knowing full well that we're free to ask for help as needed. And sometimes the help may not be there. And so as a role model, I'm going to show the young woman who's observing me how to try to navigate that process. But at the end of the day, it's a community effort of trying to get the information out, of providing the support that is needed. And I know that this is kind of outside the realm of your question, but there was also a question about how can we provide better access for parents, especially the women, when they're the caretakers. And one of the things that I've stressed, even at my role at the federal level, is that we need to meet the parents where they're at. We cannot expect parents to come to us just because it's convenient for us. If we're actually trying to deliver those services, then we need to meet them where they're at. And if that means that you hold sessions, informational sessions, or you hold vaccine, deliveries at night, and you provide childcare, or maybe you provide a quick warm meal and the childcare where the parent is getting vaccinated, then you do that. And you do that in the home language. As a society, we seem to think that everybody has to adjust to what's most convenient for the bureaucracy that exists among us, but it should be the other way around. The bureaucracy has to take a back seat, and we need to meet the community where they're at, because that is the only way that you're going to be able to deliver the services that accommodate the needs of everybody.
Mm-hmm. I agree with you. I think we have to meet people where they're at. And one of the things that we're trying to do here is to start doing some mobile clinics to accomplish that and to reach some of the rural areas. But, and I think, again, trust, right? So a trusted resource coming out to the community will be effective. What we're seeing here, though, is like a vaccine clinic that goes mobile into a certain community may not get much response if it's still not someone that they trust, right? So I think we kind of have to couple those things together and say, we're coming out to you, but we're doing it through a community center or a church or someone, not just a government institution or something like that. When we're talking about reaching vulnerable populations, when we're talking about immigrants, and many of whom might be undocumented, but absolutely right that we have to meet them where they are, and we have to do things in the evenings. We have to do things on the weekends, the childcare. And one of the ways that we were trying to address that, I know this was a question in the chat about, a childcare or bringing their children to the appointment, is potentially having more drive-through model services so that you can drive through and get the care that you need or get the vaccine, and your kids can be in the car with you. That accomplishes a lot of different things at once. So, you don't have to worry about childcare. You're also doing some of this sort of modeling the behavior. Your child is seeing you get the vaccine. Maybe that provides an opportunity to have a conversation about, mom, dad, what is this? What's this vaccine? Or, just being able to open up some conversation. But I think those drive-through models can be very effective. Personally, I'm a new mom, and my baby he's almost 4 months old. So when you have a baby, trying to get them in and out of the car can be a lot, right? So if you have that drive-through and you can keep the baby in the car, especially with the pandemic, you're trying to limit their exposure. So those are just a few ideas, maybe of ways that we can move forward and see a light at the end of the tunnel here. We do have the vaccine now, which is great. We are trying to get it out to communities, but we still have some work to do. And how can we continue moving forward and making sure everybody has the opportunity to get the vaccine? Because up to this point, I don't think that's been the case. We had some data came out in North Carolina that 2% of Latinos have been vaccinated, or of all the vaccines, only 2% were Latino. And that was when Camino was like, all right, maybe what can we do here? Let's step up and see how we can help. So it's hopeful, but we still have a lot of work to do.
And along those lines with the data points, I read a New York Times article this morning, and it said in Texas, 42% of the population identifies as Hispanic, but only 20% of the vaccines have gone to the Hispanic community, right? So we're seeing this disparate numbers showing up, which is disheartening, because at the end of the day, I love the idea of doing like the drive up, the vaccine, But I don't know if you saw an article recently, or it was an interview where a parent did that. She didn't have childcare. And in this particular community, she drove through to get her vaccine and they wouldn't give it to her because she had her child in the car.
Ah.
And so that takes me back to the whole, like, we need to educate the people who are running the show, that they need to be flexible and they need to accommodate the needs of others. You know, I personally, I'm an attorney, and I remember I had weekend court, and my childcare, decided to dip on me, didn't show up. And I had to show up in court with my 2 kids. And my goal was have them sit in the back of the hearing room. I'll do my hearings and I'm done. And I was reprimanded by the female sitting judge because I showed up in juvenile court with my kids. So their employers also need to start understanding and be accommodating to women who are raising children and who may be the sole caretaker, or even to women who are not only taking care of their kids, but their elderly parents and are the sole caretakers. And how do we accommodate them? You know, one of the biggest problems that we saw is, like I said, you know, the federal government under the CARES Act said you're going to get up to 80 hours of paid leave if you are personally affected by COVID or if you're taking care of someone. And we were hearing from some community members that their employer was denying them access to that. And so that's been a problem that we're still trying to deal with. Obviously, the CARES Act has now eliminated that piece, but that was a problem that we dealt with for over 8 months.
Thank you. I'd like to give you now time for you, spare 2 minutes each. What are your last thoughts about this particular topic? How this, it's a multi-layer pandemic, how a word of hope, if there's any?
Well, I think that there's some hope in the vaccine. I do truly believe that. And, you know, the fact that there are several organizations that are trying to make it more accessible. Again, I think we still have a lot of work to do, but I think there's hope in that. But another couple final thoughts I would like to leave with are going back to my first bit of the conversation about mental health. I would really like for us to do some more work around breaking the stigma of mental health. I think that it is completely okay to ask for help, and it should always be okay to ask for help. And especially for women, and not feeling like they have to do everything themselves, whether they're a mom or not, or, taking care of their elderly parents or whoever, that we really need to normalize asking for help. We need to normalize seeking counseling. Every person could benefit from counseling. I truly believe that. We all need somebody that we can talk to about our problems and our issues. But I would like for us to continue working on really breaking the stigma in the Latino community. At Camino, each year we partner with UNC Charlotte to do a Latino mental health summit where we talk about some of these issues with some of the health professionals in the community. We're going to be doing more work of going out and doing community education around behavioral health, and I think some of those things will help. But that's kind of where I'm leaving my final thoughts are of this idea that it is okay to ask for help, and that I want women to know that, and I want young girls, as we talked about, as seeing role models, to know that that is okay. And I think it can be really difficult for women who are in single parent households and things like that and don't have extra support at home. I know for me personally, I have a husband who's very caring, very supportive, and really we're 50-50 on helping out with our child, but not everybody has that. So I think that being able to say, I need some help, and not feeling embarrassed or feeling guilty or feeling judged for that is something that I think we really need to continue working towards. And I believe it in all communities, but like I've said, I know it's heightened in the Latino community about the idea of seeking any kind of behavioral health. I think sometimes it can be how we frame it and the messages that we send. And again, making sure it's coming from trusted resources like community organizations. I know that I've tooted Camino's horn a lot. I think we do a great job, but there are plenty of other organizations that are doing great work as well. And so it just needs to come from somebody who is genuine and that the people in the community feel that they can trust.
Thank you.
And my hope is that as a result of COVID, we've actually laid bare the disparities that exist among the minority communities, especially within the Latino community. And we're seeing, at least in my state, how public health officials and medical professionals are actually rising to the occasion and pushing the legislature to ensure that any data that's collected is disaggregated by race and ethnicity, because what some people seem to not realize is that data is usually collected as Black or white, and people fail to ask that sub question of, are you Latino, yes or no? And so we're really pushing for that across the board, not only in the, the health delivery models, but also schools, DCF, all the major systems so that we can really start to pinpoint where the disparities lie and then start targeting services to do away with those disparities.
Thank you so much for this very enlightening conversation, Dr. Kerry Reeves and Ms. Marlene Sallo. I really appreciated you participating this morning in the 2021 Women and Girls Alliance Summit. Thank you very much, and everybody have a great day.
Thank you very much.
Thank you.
Sorry I was late.
It's okay. I don't know where you guys are. My computer is kind of like, it gets up here. You are. Okay. No, you just came right in, and I had a script with Keri first. So
yeah, I was so sick this morning. So I apologize.
Oh, no.
Anyway.
Feeling better?
Yeah, I had one of those really bad migraine episodes, which just it affects my stomach and everything else that goes with it. But finally the medicine kicked in. So anyway.
Good.
So thank you very much for the opportunity.
And thank you for letting me be a part of this. I enjoyed listening along.
You're welcome. But we're not live.
A lot to talk about, and I think an hour wasn't enough. I could have gone more on digging more information, dig more on the statistics.